The head of the World Health Organization is warning that the Ebola outbreak in Central Africa is on track to be the deadliest ever. More than 2,000 people have been killed, with at least 4,300 cases in the current outbreak in the eastern Congo. For more on this, we're joined by CBS News foreign correspondent Ramy Inoncencio in our London newsroom. Ramy, good morning. So what more can you tell us about this newest warning from the WHO?
Hey, Michael. Yeah, good morning there. People have been dying faster in the past 3 weeks, basically. This Ebola outbreak was officially declared on May 15th. The first 1,000 deaths happened in the first 9 weeks, but the second 1,000 deaths happened only in the past 3 weeks. And that is why Dr. Tedros came out with his warning. Take a listen.
It's moving faster than any previous Ebola outbreak. At its current pace, it's on track to eclipse the West African Ebola outbreak of 2014 to 2016.
Yeah, to put that into context, in the West African outbreak that he just mentioned, more than 11,000 people died there. Nearly 29,000 people were sickened. That was mainly in Guinea, Liberia, and Sierra Leone. And of course, that is a number no one wants to get any closer to, but health officials say it could still be 3 months until this outbreak is under control. With this outbreak, though, health officials are concerned that this virus could also be mutating. That is from the WHO yesterday, and that there still is no vaccine for this, but trials, one in particular here in the UK, are underway. Michael.
And Ramy, do we know what's driving the spread of this outbreak, why it's so severe?
Yeah, for a lot of reasons. As we had been reporting when we were in neighboring Uganda in June, a perfect storm of reasons. That is what so many people told us on the ground. Political, in that a lot of people in this region, in Ituri, haven't trusted the government for years. And that's why we've also seen now at this point more than a dozen attacks on clinics in that region. Ituri is also on the eastern border of the country. Kinshasa is the capital, more than 1,000 miles away on the western border. There's also a religious, cultural aspect to it. You see people here zipping up bodies into bags. And that's because it's normal for burials to be very tactile, where people touch the bodies of their dead loved ones, but they are very much contagious, and that does spread Ebola. The region also hugely violent. By one estimate, more than 120 armed groups there fighting for resources and land and political control. And anyone familiar with what's been going on in the DRC is very familiar with the ongoing conflict, in particular with the M23 militia that's backed by Rwanda, that kicked off almost 15 years ago. So again, this perfect storm, and none of that I just rattled off is going away.
All right, Ramy Inoncencio, thank you.